A confluence of respiratory illnesses has some California officials warning of a possible triple threat that could strain healthcare systems. Parts of the state are experiencing the earliest start of flu season in recent years, while respiratory syncytial virus, or RSV, is spreading widely and sending significant numbers of young children to the emergency room. Casting a further shadow is the looming threat of COVID-19, which many health experts expect will rebound this fall and winter as more residents travel for the holidays and colder weather pushes activities indoors. We are potentially going into what people are calling a tripledemic, or a tridemic. The respiratory illness is the most common cause of pneumonia and inflammation of the airways among babies. Warnings that circulation of another virus could exacerbate the challenges posed by COVID-19 are not new. In 2020, officials braced for a possible twindemic ahead of the typical flu season. And while a horrific COVID-19 surge did materialize, the flu fizzled out. The following year played out much the same way, lots of COVID-19 but not too much in the way of flu. However, this year's flu season has already begun, and is demonstrating a potency not seen in the pandemic era. We're seeing the highest influenza hospitalization rates going back a decade, Dr. José Romero, director of the U.S. Centers for Disease Control and Prevention's National Center for So far this flu season, there have been 2 pediatric flu-related deaths nationally. San Diego County reported its first flu death of the season, a 55-year-old man who had underlying medical conditions and hadn't received a vaccine. It is still early in the flu season and we are already seeing cases spike, so we have reason to believe that the flu could be extremely disruptive this. Since October, 10 flu deaths and 3 RSV deaths have been identified by the California Department of Public Health, based on an analysis of death certificates.